Dr. Nadiv Shapira and Stephanie McLane from First State Vein and Laser Med Spa in Wilmington, Delaware. Stephanie, I am going to be giving you control now so you can begin.
Thanks. Everything okay?
Yes.
Okay, great. So for those of you that don't know me, my name is Stephanie McLane. I'm a lipedema patient of Dr. Shapira's. I was actually Dr. Shapira's first lipedema patient. And we're here today to talk a little bit about our practice and some steps that you can take, to be a patient of Dr. Shapira's, and just some things that we recommend throughout the process. I first noticed that I had lipedema when I was 22 years old. It was immediately following the birth of my twin boys. And I noticed almost right away that I had some significant swelling and pain in my legs. They started to, they were continually getting larger no matter how much I exercised and dieted. I was a spinning instructor. I danced, ballet, tap, and jazz my whole life. So it really didn't make any sense as to why my legs kept getting larger and more painful as I got older, especially, like I said, it started when I was 22 and it really just continued for many, many years after. So it was through a Google search, actually, that I stumbled across the word lipedema. And I remember thinking, oh my goodness, what is lipedema? How did I get this? After seeing photos online, I realized that some family members of mine had also had lipedema, particularly my grandmother on my father's side, and I don't believe she was ever diagnosed. I realized shortly thereafter that is, it did seem to run in my family. So after, seeing the word lipedema and trying to figure out, what do I do now, I stumbled across a Facebook group called Lipedema Sisters. And it was through the group that I learned of, Dr. Stutz in Germany, who does liposuction for lipedema, all sorts of different conservative therapies and supplements, and Dr. Herbst, and it was a completely overwhelming experience. I remember spending many of those many, I guess, first months, being completely overwhelmed and just not knowing what to do with myself or where to start. I ended up making an appointment to see Dr. Herbst. And prior to my visit with her, I also was lucky enough, Dr. Stutz was in the United States training some other physicians, and I did have an opportunity to meet with him. He did confirm that I had lipedema. And I flew out to Arizona to see Dr. Karen Herbst in 2014. It was at that time, I believe it was the end of 2014, Dr. Herbst told me that I did have stage 2 lipedema and diffuse Derkham's disease and Ehlers-Danlos syndrome. So, I left there thinking, so glad that I finally had a diagnosis, but then thinking, okay, what now? She did recommend that I could undergo the WAL, the liposuction procedure. However, through the physician that I had seen prior to her, there was a surgeon that I had met with when I saw Dr. Stutz, and he quoted me $56,000 for these procedures, which at the time was just not an option. So I kind of, went back home after my diagnosis, feeling sort of defeated, and went back to my trusty Lipedema Sisters Facebook group. And I met a woman there. Her name is Laura. She has actually become a very good friend of mine. She did introduce me to this fabulous doctor that she knew of in Wilmington, Delaware. His name was Dr. Shapira. And she had told me at the time that he had been going to Germany and had trained in, the WAL procedure and learned everything through Dr. Stutz. And so I remember calling his office and basically saying, listen, I heard that you're, going to be practicing soon. Laura sent me, kind of said, please just let me come in so we can talk. And he agreed, thankfully. And Dr. Shapira also confirmed that I had lipedema, and we discussed the option of, how we would handle this situation with insurance companies, because at that time there was no other provider in the United States that was participating with insurance. So Dr. Shapira said to me that if we were going to go forward, that he wanted to figure out a way that we could work with my insurance company to get me approved. So that's what we did. We came up with, some like a list, I guess, of things that we submitted to my insurance company, trying to prove medical necessity. And I was one of the very first in the United States that actually got approved upon my first submission, which is almost unheard of, especially these days. So I was very, very lucky that my insurance approved my surgeries. So we went forward with my procedures. I had 4 WAL procedures in 2015. And it was after, I believe, my second procedure that Dr. Shapira, we had kept in close contact throughout the whole recovery and all of that. And, he and I had spoke about, what we could do, or what he could do really, to open up his practice to the rest of the community. And he had asked me to come on board with him, as a patient, the patient care coordinator, so that we could, help everyone else that we, as best as we could, especially with insurance companies. So that sort of brings me to where we are today. I am Dr. Shapira's patient care coordinator. I work remotely from home. I'm in Pennsylvania. So a few things. If you are looking to become a patient, you can contact me either through our website, through my email address, or the telephone. And at that time, I can send you the new patient packet. In this packet, you will receive a very full, it's quite an extensive packet, I guess we could say, that takes a full medical history, symptoms of your lipedema, and all of that. So once you receive your packet and send it back to me, we can set up an appointment for you to be seen. We do offer 2 types of appointments. Obviously, an in-office consultation is always preferred so that the doctor can see you in person. However, especially now with COVID and everything going on there, we are offering telemedicine visits, which are nice. And thankfully, insurance companies are now allowing us to bill for those. So that's been a really great step in the right direction here. So during your consultation, Dr. Shapira will go over all of your history, discuss your lipedema symptoms, what brought you to the office, and at that time, he will determine whether or not he thinks you're a good candidate for surgery. So when you leave the office, usually within a few days, I will send you the report from your visit. Doc usually attaches into that report what we call your to-do list. And this list is pretty much everything that he thinks that he would like to see you complete to show your insurance company that the WAL procedure is medically necessary for you, because so many insurances will automatically see codes for liposuction and they get denied for cosmetic or whatever other reason. So your to-do list could pertain any of the conservative treatments if you have or haven't completed them. So sometimes, he will refer you to see a lymphedema therapist so that you can, get trained in wrapping and MLD and all of those things. Sometimes seeing an orthopedic doctor, or, your primary care, whomever else, that we think should be part of your care team. He'll also discuss with you, proper diet, because, you want to make sure that you're eating right for your body, and especially when you have lipedema and inflammation and all of those things, supplements and garments and all of those other things that are considered conservative therapies. So one of the other things that we do in our practice is with the insurance companies, Dr. Shapira likes you to work closely with your other providers so that he's not the only physician making the determination that this procedure is medically necessary for you. So that can also, would go back to, meeting with your primary care physician or, an orthopedic doctor if you have one. We like to make sure that your whole team is on board for the process. So that brings me to the insurance process. One of the nice things that we try to do at our office is we really do try to get all of our patients covered through their insurance companies. The majority of our patients have been covered, which is great. We do have some that have been denied. Unfortunately, that's sort of just the nature of the game, I guess, at this point, until the insurance companies really recognize lipedema as a real disease. So we do everything that we can to get you approved so that, there's very little to no out-of-pocket cost for you. So we recommend during that time that you get a copy of your insurance company's plan. So it's usually a very large document. You want to make sure that you have a copy of that so you can see, what their restrictions are on liposuction and what they deem to be cosmetic procedures. So it's important that we have all of the information that we discussed on the previous slide so that we can prove to your insurance company that the procedures are medically necessary. Another thing that we like to include when we submit to your insurance company for pre-certification is your bio or your lipedema story. So this is basically a letter that you write to your insurance company, explaining to them in great detail, when you realized you first had lipedema or what might have brought it on, be it puberty or pregnancy or menopause, the activities of daily living that you could do prior to your diagnosis that you can no longer do, and basically how lipedema affects your everyday activities. Those are really important to show to the insurance company, again, to prove medical necessity. So typically, once we receive all of this information that is in your to-do list, it's at that time that we would submit to your insurance company for approval. Sometimes this is done rather quickly, depending on, how many things that you had done prior to coming to see Dr. Shapira. So once we have all of those things, we submit to your insurance company, and sometimes they turn it around right away. Sometimes we have to wait many weeks. That's sort of just the process. We never really know going into it because each plan is so different. How long it's going to take, because that is typically a question that we get asked a lot. So at that time, you're either approved or denied. If you're approved, then we, go forward, put you on the schedule, and go forward with your procedures. However, if you are denied, you usually have the option to appeal, and that is something that you can do on your own, or our office can help you with that should you choose to do that, to take that route. My biggest suggestion here is to not take no for an answer. So if you go to your insurance provider and say, I have a gallbladder disease or whatever, a broken bone, they wouldn't turn you away. Lipedema is a real disease, so don't take no for an answer. We will fight the fight alongside you. Just be prepared that you may need to do that as well. So some preparations when you're moving forward with your procedure, and I tell this to all of our patients. These are some of the things that I learned through my own diagnosis and my own procedures that I think are really important for all of us. So have realistic expectations. Depending on your age, your stage, your genetics, some people are really looking for cosmetic improvement, which is great. I mean, we all want that. However, that's not to say that we're all going to get that, because again, the idea of WAL is not for cosmetic improvements, although we do typically expect some. But really have realistic expectations. You don't want to set yourself up so that, you're expecting one really great outcome and then maybe you're disappointed with the one that you actually get. So it's important, I feel, to make sure that, that you are being realistic about, what to expect afterwards. Another thing is to make sure that you're prepared both physically and mentally. So the WAL procedure is not a drive-through procedure by any stretch of the imagination. Surgery is trauma, it's pain. Some people experience more pain than others. I was one of the lucky ones that experienced a lot of pain. So you want to be prepared for that. Make sure that you have enough time taken off from work. You want to gather some people for support, be it your spouse, your friends, your family, coworkers, whoever you think, you can get the most support from. I really think that that is super important. The first couple days after surgery are typically the most difficult. So, you're not going to want to be alone, at least for the first 2 or 3 days. Getting up can sometimes be difficult, and getting around and those sort of things. Changing your garments can be hard at first too. So having support is really important. Prior to your procedure, I would suggest that you get plenty of rest. We have found that, if you come to your procedure very stressed out or very tense, or, you're very nervous, your body really tenses up and it makes it sometimes difficult for you to relax during the procedure. And we want you to be relaxed so that you can move around as much as possible. You'll be awake. So yeah, it's important to make sure that you're getting plenty of rest. And my last thing really is just be kind to yourself. Lipedema sucks, if I'm allowed to say that. It's not, I know most of us that have it don't feel good about ourselves. A lot of times it takes a toll on us mentally, especially with self-esteem and those sort of things. So I always say, if you're going to go forward with your procedure, the number one best thing that you can do for yourself is not to compare your body or your own story to another lipedema patient. Mostly because, like I said earlier, not everyone is the same age, the same stage, has other issues. Some people have, like we said, have really great cosmetic outcomes and some don't. So you really want to just make sure that you have your realistic expectations, and just be kind to yourself, because surgery, like I said, is trauma, and you want to make sure that you're prepared and don't be too hard on yourself, especially afterwards. A lot of us, and I was one of them, experienced a great surge of emotion after each of my procedures or our procedures. So that's typically what we believe is the release of some hormones that have been stored in the fat tissue. So a lot of times some of us, will be upset or even depressed. This is, I don't like to say normal, because I don't think it's normal for anyone to really be depressed, but it's par for the course. So you can expect that to happen. So just be kind to yourself. That's, some advice that I wish I had taken, when I was going through this. So that is all that I have. I'm going to turn it